Welcome back, y'all. Today's guest has been there and done that. From New York City to Wheaton College to now Boston. He's been changing the game in his community everywhere he's been. Everyone clap it up for Mr. Dalwin Corcino.
Hey,
I
what's
go.
up, everybody? Thank you for having me today, Nathan. Appreciate being on this special podcast. Dalwin Corcino, he, him, his pronouns, and I'm really happy to be here and share with you all.
Yes, sir. Yeah, me and Dalwin go way back if y'all don't know. One of my earliest mentors. Shout out to Randolph High School. Shout out to Codman Square. But just happy to have you on the podcast, Darwin.
Thank you,
My
brother.
public health goat personally, one of my favorite public health professionals out there. Great inspiration. Wouldn't be here without you. But as your intro song, we got this Bad Bunny song, Yo Visto Así. Tell us about that song. Why this song, Darwin?
Oh my goodness. So many reasons. I mean, first of all, Bad Bunny, like, come on, man. He's a game changer. He defies social norms, societal expectations. He speaks the truth. He advocates for his country, Puerto Rico, colonized country. It's a U.S. What's it called? A U.S. territory. Not they don't have their own. They don't have they're under the U.S. And I love how he speaks to the freedom and the liberty and the needs of his people, his country, and the oppression that they face across history. And I think Yo Visto Así, that song really just speaks to like I do what I want. At the end of the day, I don't care what other people have to say about me or have to say about my ideologies or my beliefs or what it is that comes out my mouth. He is what I aspire, who I believe, who I think I am. Somebody who really doesn't think about what other people have to say or other people's opinions. They are valid, yes, and don't let them get to you, because I feel like once you let what other people have to say, especially if it's a negative commentary or against an opposing ideology or belief, I think that that's when you start getting in your head and are like, oh, am I doing the right thing? Am I saying the right things? Am I dressing the right way? But I don't know if you've ever seen like Bad Bunny showing up to like the Met Gala, like
Mm-hmm.
skirts, amazing suits, like just his fashion really also defies gender norms and gender roles and gender expectations. And I think I'm somebody who believes that we society changes, people change, our beliefs change, how we function as humans changes. So I think that it's okay to be different and it's okay to dress how you want to be. Because yo visto así literally translates, I dress how I want. I dress how I do.
Yes, sir. Yeah, we love an unapologetic brother in public health. And just that's a good influence, man. We love an unapologetic brother just in general, man. So shout out to Bad Bunny, man. And that that's in all ways, man. We all should. I like that message, man. We all need to if we're ever gonna make a change, we have to be unapologetically ourselves, and we have to truly advocate for what we believe in, man. That's what's up.
In a respectful way.
Yeah, of course.
Respectfully.
Yes, sir. All right, but so darling, just give us a little background about your public health journey. Was it a straight path? Did you know, like fresh out of high school, public health, public health, public health, or were there any like twists or turns along the way? Tell us a little bit about
So
a little bit more about
twists and
yourself.
turns. So many twists and turns, so many unknowns. I mean, to be honest, like many, I didn't even know what public health was until I learned what public health is and how broad, how intersectional, and the breadth and depth of just opportunities and careers in public health. Um,
Mm,
Like you said at the start, yeah, I'm from New York. I was born in New York. I grew up in Harlem. Love New York. Still claim that as my city. When I was 6 months old, though, my mom did send me to the Dominican Republic. So I was raised among family, aunts, uncles, grandma, cousins. And then I started schooling over there as well. Ever since I was young, it was either, as for many communities of color, it's either doctor, lawyer, pick one, and you gotta stick to that. So for the longest time, I mean, obviously, like during childhood, I changed, a lot of careers, but really when I moved back to, I started schooling in the Dominican Republic, moved back to the U.S. in New York. When I was like around 6 or 7, when I got to high school, really was when I was like, all right, yeah, doctor, 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 doctor. We got this. And so my family was very excited for me to become a doctor, but it actually wasn't until my first year in college, Wheaton College, like you said, I was afforded the opportunity to receive the Posse Scholarship, which is through the Posse Foundation, which is a full tuition leadership scholarship. And, they're based across the country in the U.S., very different cities. But they actually do have a program in Puerto Rico that's for the arts with Lin-Manuel Miranda, which I think is pretty cool. Shout out Puerto Rico again, my sister island. But I think when I got to undergrad, first year, neuroscience major, pre-med track, I was taking those for in my first that fall semester, fall 2019, I was like Bio 101, Chem 101. I had like a first year seminar course. I forgot the other class. But anyways,
Not familiar.
yeah, yeah. That sounds yeah, that checks out. So, I hated bio. I think bio tanked my undergrad, one of the courses that tanked my undergrad GPA. But secondly, I hated chem.
That understandable,
I
man.
actually ended up dropping chem,
Mm,
and that put me behind in credits.
mm,
So that was a struggle because I it was like after the ad drop period. So it wasn't until end of junior year that I really ended up catching up with the credits that I needed to be able to be like cleared to graduate by senior year, by the fourth year. But it was after taking it was Business 101 actually, that I was taking. That was that fourth class, fall 2019. He was actually a VP. He worked at Hasbro. He was one of the big guys at Hasbro. So he was, and I loved him. He's an amazing professor. So I actually took advantage of office hours. I'm a very outspoken, outgoing person. So, if you have time where I can go talk to you, yeah, I'll go talk to you if there's an alignment. So I went to his office hours and I talked to him a little bit about like the challenges that I was facing during that first semester, first year of undergrad at a predominantly white institution. And this is me talking to another white man, older white man, but he's worked across the country, like across the world. I mean, like one of the things that he really emphasized in his class was like being mindful of time zones. And I see that parallel in that kind of mindset just within Brothers in Public Health. Like we got Brother Winston out in a different time zone. So when we're trying to coordinate meetings, it's like we got to be mindful of that. So, anyways, so went to his office hours one day, and I'm sharing, I had to drop this class. I really don't think neuroscience is for me. Like, I don't think I'm gonna be successful. I don't think this is gonna work out. I think I'm gonna flunk. And he started talking to me about, kind of the intersection. There was a unique major with a specific concentration in the business department around healthcare administration. So he encouraged me to like consider that, think about it. But then in that second semester, I actually took an intro to public policy course. And then I spoke to that professor, amazing, amazing professor. She ended up leaving Wheaton after after talking to her, she talked to me about healthcare policy. specifically. It was an intro to public policy course, but I didn't realize there was like concentrations within public policy. And so after learning about that, I had then sophomore year taken a global health course. And so I went back to that political science professor, and she was like, "Well, it really sounds that like you have a passion for health and healthcare, and also kind of making system level, institutional wide, systemic change through public policy." And so I was like, that sounds cool. And so she then mentored me and coached me and really supported me throughout my sophomore year in undergrad to develop an independent major in healthcare policy. It was a very interdisciplinary major because I combined anthropology, political science, economics, business, public health, psychology, sociology, history. It was very extensive in terms of the content that I was able to curate based on my interests and where I envisioned I wanted to go. That summer of sophomore year, this is all during COVID, by the way. So I really actually only had one normal semester in college. So my first year, fall 2019, was my normal year of college. Then spring 2020 came, still first year. Spring break came. We all get an email. You all got to go home. Yeah. So I ended up moving to Arizona, Phoenix, Arizona, actually, during that time. And when we got back, yeah, this was all first year, 2020. Once campus opened back up in the fall of 2020, we were getting COVID tests two to three times a week. They had a dorm dedicated to like quarantine. It was insane. Being in college during COVID, not insane. Just insane. Wouldn't wish it on anybody.
Mm. Yeah.
So, sophomore year in the spring semester, we had this really cool experiential learning opportunity. It was like a Wheaton internship for credit. So you get an internship for a semester long internship. You get a professor to kind of like mentor, supervise what you're doing, uh, reflective writing around the experiences and what you're learning, which was really nice. And I actually had an internship with Physicians for Human Rights as an advocacy and policy intern. And I'm not sure if you're familiar with, are you familiar with Physicians for Human Rights?
I don't think I've heard of them.
So they use science and medicine and law and advocacy and public policy to really secure human rights and justice for all. And they do their work around the world. They were actually founded, I don't know if you've ever heard of Dr. Paul Farmer.
I don't think I've
No,
heard of them.
come on. He's a legend in the field of
Bro.
public health. Like that. I'm giving you homework.
I'm taking
Next
notes.
time
I'm
we
taking
talk,
notes.
yeah, next time we talk, you got to tell me one thing about Dr. Paul Farmer. He is a legend, and he, I believe, is one of the co-founders for Physicians for Human Rights, as well as Partners in Health. Not sure if you've heard of them, but they do international kind of public health work. And so during this time, while I had this internship, again, midst of COVID, we're in the midst of, in the US, a spike in ICE presence in immigrant communities. So this was like when all we were hearing on the news was like everything that's happening in ICE detention centers. Uh,
Mm.
a part of one of my responsibilities as an advocacy and policy intern was attending congressional hearings on legislations or activities related to COVID or immigrant rights. Also, the Myanmar refugee crises was occurring around that time. So I was really responsible for providing updates on those congressional briefings, any news updates coming out of Myanmar. Physicians for Human Rights has medical providers literally on the ground across the country delivering care to people who need it, regardless of what's going on in the country. Like there could be a war and they're there. And learning about that level of commitment and seeing it, I was just like, wow, so this is what healthcare policy is. This is what advancing social justice, civil rights, human rights means. I'm all in. I'm all in. So hence the healthcare policy major at Wheaton, an independent major. But then I had some other internship opportunities that kind of just continued to reinforce that. As I was kind of like finishing up with my undergrad career, my undergrad degree, I was again COVID. I really wanted to go abroad. That didn't work out during COVID. But the other opportunity that I came across was a public policy and international affairs fellowship. I really thought that after undergrad, I wanted to go to grad school, either get my master's. I knew I didn't want to do the master's in public health because again, the science didn't work at the beginning. I don't think it's gonna work again. So let me not do that to myself. So then I was really considering a master's in public policy. So I applied to this public policy and international affairs fellowship. I got accepted, and so I actually spent the summer before my senior year at the University of Michigan Gerald School of Public Policy, where I was taking master's level courses for a master's in public policy. Actually, fun fact, I mean, this is great news. Abdul El Said just got elected as state senator for Michigan State. Took no PAC money, like amazing win. And he used to be the commissioner for the Detroit Department of Public Health. And he actually was one of my professors during this fellowship. I know, crazy wealth of knowledge. I mean, also one of my professors was a U.S. ambassador. I forget the country. I forgot the country, but she was a U.S. ambassador. Just the faculty at the Ford School of Public Policy at UMich, amazing, incredible people. A lot of patience, especially for somebody who is not quantitative savvy, I would say. Like, I'll get the big picture concept, but when it comes to doing the quantitative analysis, don't look at me. I'll understand what you're saying, but don't have me do the work, cause yeah, that won't make sense to me. But that's when I realized then too that after that experience that I actually didn't want to do a master's in public policy either because it was so quantitative based and heavy and a lot of analytical, like using R studios data, like that's not for me. So I came back to campus senior year. um, I was student government president, which was insane. Like, did not, never in the 4 years of undergrad did I think junior year I was going to be running for president, for student body president. And I did. I ended up doing it and I got elected. And it was an amazing, amazing learning experience that's really helped build a lot of the skills, especially around leadership, team building, working with people, delegating, like all those things that really helped me grow as an individual and as a person. But I think that that's when I also realized like I really don't think I'm ready to commit to going to grad school because that's a commitment. I think I need work experience. And so that's how we got to where I am now at the Mass League of Community Health Centers.
Wow, man. Talk about twists and turns, man. I mean, but the through line, man. That's shout out to all the mentors and professors we've had along the way. If it weren't for them, I wouldn't be here. So all the influence just keeps circulating, man. All the mentors out there. My hats off to you, man, because Look at what Dalwin's doing now, man. Look at it's amazing. How,
And huge shout out to Brenda Weiss. She was my posse mentor. That woman had patience for us. Like, God bless her.
man,
I don't think I would be where I am if it weren't for her.
mm,
Yeah.
yeah, man. That's a crazy journey, though, man. You said you made your own like independent major at your university. That that's a crazy like it. I can't even fathom doing that, man. So it's just like I think I've heard. Didn't Alex do the same thing too for his undergrad experience, or he did something? He tried to do something
Something
similar.
similar, I think. Yeah.
Man, public health calls you at the end of the day. If public health is calling you, there's a way to get to it, man. Like that's crazy, man. That's
Absolutely.
you're in the right field, man. We're happy to have you, man.
Thank you, brother.
So we the story kind of left off at the Mass League, and if I'm not mistaken, that's your current position right now.
That's correct. I'm a program manager for workforce and training at the Massachusetts League of Community Health Centers, and it is the primary care association for the state of Massachusetts. We represent and advocate and support federally qualified health centers. There are 50 in the state of Massachusetts, serving over 1 million patients in the state across 98% of Massachusetts zip codes. I started off as a program coordinator for loan repayment programs, and then about 3 years ago, 2 years ago, I'm sorry, I was then promoted to a program manager for our department.
Nice. So I think that this is where you run into me while I'm at Randolph High School, but it seems like your position has changed a little bit. So if you don't mind, could you give us a breakdown of and you're working on so many different projects at this organization. Could you just give us a breakdown of like your favorite role or your favorite project or like what a day in the life is like for you at the Mass League, or just
Yeah,
however you want to answer it, you know?
yeah, absolutely. Yeah, we definitely did meet while you were in high school, which is like insane to think about.
Crazy.
And then you're about to start your junior year in college.
Yes,
Like
sir.
the way I've seen you grow, brother, it's amazing. It's rewarding to see young brothers and sisters grow and just lead the life they want to lead and live the life they want to live. So I'm very proud of you as well, Nathan. I hope you know that. You're doing Randolph good. You're doing Randolph good, brother. Randolph High School.
Trying to represent, man.
Yes,
It's on the map.
absolutely. So to your question, LOL, makes me laugh. No day looks the same. Let's start with that. So in my role as program manager, I oversee various workforce and training initiatives, and that ranges from workforce capacity building, so delivering training and technical assistance to community health centers, leading youth workforce engagement initiatives. So that's kind of how we met. Through a pilot program. I support the implementation of legislation supporting access to career pathways for internationally trained physicians. I support behavioral health professionals, programming that supports behavioral health professionals attain their licensure, AI integration into healthcare, program evaluation for all the initiatives that we lead. I work very closely with national agencies and governing boards and organizations. But most importantly, what I love about my day to days is when I'm a person who like the day before, so it's a hybrid work schedule. I'm typically in days, 2 days a week, 3 days work from home. But on the days that I have to go in person, like the day before, I gotta check my schedule. I mean, not even just when I go in person. Any day of the week, I gotta check my schedule the day before to figure out what am I doing tomorrow. But what lights up I usually do this in the afternoon, evening, like when I'm getting ready for the next day. What lights up my day is when I see that I have a meeting with a health center on that given day. I think that the people who work at community health centers they're just different. The grounding that they bring, the energy, the joy, the love, the compassion, the empathy, the cultural humility and responsiveness to want to understand what it is that you need. There's nothing like it. I mean, the better, like the health center safety net is saves the US healthcare system millions of dollars. I won't say the number because I don't want to get, because if I get fact checked, it'll probably be wrong. But at the end of the day, community health centers across the country, shout out to shout out to
All the community health centers, honestly, man. But is there someone specific?
yeah, there's somewhere specific. So the health center movement is tied to the civil rights movement, Freedom Summer, Lyndon B. Johnson, the war on poverty, like all the Medicaid, Medicare, Head Start, all these national programs that have been federally funded for since the passage like 1965, 1966, after the passage of the 1964 Civil Rights Act, all of these national programs meant to support marginalized, underserved, underrepresented communities. It's boomed since then, and people don't realize that community health centers, it's a movement. It's a movement. It's not a moment, and it started in back in 1960. Well, actually, if we go back, the health center movement actually started in Falela, South Africa, with Dr. Sidney and Emily Clark and Dr. Jack Geiger received the fellowship scholarship award, and he went out there and met them and learned about the community health center model was and how it really looked to address not just your physical health, but the social determinants of health. So he and Falala, this is where it originated, the health center model in South Africa. And he came back to the States. He was a professor at Tufts as well. And he worked with some other doctors like Dr. Count Gibson, John Hatch, all doctors. And, he really, they came together, advocated. Another one, a sister, Elsie Dorsey, Andrew Jack. He was the first registered sanitarian in Mississippi, first black registered sanitarian. And he helped build like wells, functioning pipes, clean water to Mississippi. But yeah, like the health center model, it's so comprehensive, and the people who work there, like I just, how can you not? How can you not love them?
Absolutely. That's when I, as part of my internship with the Massachusetts Department of Public Health, I was working with the Office of Sexual Health and Youth Development, and a lot of my responsibilities was just like communication between their partners, which are a lot of community health centers, and just a little, even just like the just simple communication about like just different projects that we're trying to help them fund and whatnot. They really do their best to really look out for what the youth need and like how like really try to empower the next generation, man. So definitely shout out to all the community health services, health centers out there, and that's how we got. Like, that's how I got a lot of opportunities I've been able to get so far. Just that first connection through Codman Square and the way they were able to invest into Randolph High School, and even now, like as they're growing, like the programs they've got there as far as like helping students get their medical assistance certifications and nursing assistant certifications. I think the work they're doing is worth investing into, man. So just I don't know, we got to support our community health centers out here, man.
Absolutely. And so just to go back, so the first health center was actually started right here in Boston in Columbia Point, and the second one was in Mound Bayou, Mississippi. Yeah, you know Columbia Point.
That's
Your
Proctor.
school's right there. There you go. But yeah, places like Codman Square Health Center and all those across, I can't speak for those across the country, but at least for the ones that I know and I've gotten the privilege to work with across Massachusetts, they're doing the work, they're investing, reinvesting in the communities that have been disenfranchised, marginalized, oppressed, systemically oppressed, I should say.
Yeah.
And they've been pouring into the community to help rebuild, give opportunities, give them that upward mobility for self sustainment, for livable wages, for education,
Hmm.
for employment, for housing, for nutrition. Like how I don't know if you know this, but some health centers do cooking classes actually. And I think that's pretty cool. Like
Yeah,
I don't think people really realize how important eating healthy is.
yo, I might have to sign up for one. Yeah, man, I need to get on that for sure. I could use
Cool.
that. I might hit my community health center up right now, right after this call, man. Sign
You
me up.
should.
That's awesome, man. But that's there's a lot of great things about your position, man. But and just public health in general, man. Just this conversation alone is making me excited about public health all over again. But I'm curious though, Darwin. As a brother in public health, we like to advocate for men of color in this field, which we are not represented to at the utmost or at all, man. Like we make up a very small amount of everyone out here on the front lines putting in the work needed to uplift our communities, and to an extent, we've been systemically kept out of these positions, and there's so many different things keeping us out of these positions, man. But as a brother in public health, and just as a man of color in public health, how has that part of your identity shaped your experience thus far?
That's a great question. As we know, I think I don't know if the percentage has changed, but men of color represent 3.17% of holders of advanced degrees in public health, MPH, I believe, and that's abysmal and something that I've recognized since entering the field, even during the internships in undergrad, working professionally. There's not a lot of us in the field, very few. I walk into a lot of meetings where maybe it's just me. Maybe it's women of color, because that is a fact. There are more women in public health uh, compared than men. But then when you get granular to people of color, you really don't see as much. I think it's shaped my experience in unique ways, learning and growing. But I think that that was the calling for me joining Brothers in Public Health. So I came across Brothers in Public Health like through a LinkedIn post, and it was like when they first started up as a 501c3 nonprofit. I mean, I know they had been doing some pre-work and building up to that, but they started off, which I really appreciated, doing focus groups, like a needs assessment, like what do men of color in the field of public health need in this time, in this moment, and how can this organization support them. And so I joined one of those focus group sessions and heard a lot of themes that resonated with me, not having somebody who you can go to who looks like you, resonates with your upbringing or your culture or the practices. Because I think oftentimes, in my opinion, people of color, like we eat very unhealthy. We add too much seasoning that makes things like high in sodium or high in sugar. And okay, and we do still eat healthy too. Please. It's not just all unhealthy and seasoning and fried stuff. No, and I'm Dominican. We love frying stuff. I love my mangú con tres golpes, mi salami frito, mi queso frito, mi huevo frito, mi aguacate. See, there you go. That's a healthy thing right there. Avocado. I just added aguacate to my meal. with plantains, mashed plantains with a whole lot of butter though. So that's the problem. But I feel like it's having someone who looks like you, resonates with the lifestyle your culture carries. I think that's been my biggest adjustment. I think working with community health centers has actually helped me realize that you can find that in other folks who aren't men of color, because in this movement, you have to be empathetic, you have to be understanding, you have to be willing to be flexible, compassionate, caring to whoever comes across the doors, to whoever calls you, to whoever reaches out. So I've learned that I can find that support in others, and there's still not enough who look and resonate like a man of color in public health. So it's a like a I don't know if double-edged sword is the right term to use, but it's rewarding to be able to open up my perspective, to be able to console somebody who's not like me, who's not from my culture. I say I'm Afro-Caribbean because you know how a lot of Dominicans be saying me no black, you are black. You are black. You are Afro-Caribbean. You are in the middle of the transcontinental slave trade. Be real. Let's be real. Like, yeah, Spain colonized us. Okay, sure. You got that in your DNA, but your roots, your Mangu, Mangu literally comes from Africa, bro. Like that was an African concept, Western African concept. And we made it our own thing because that's what cultures do. We adapt to our customs, our traditions, our flavors. But yeah, like I think it, being the only one in the room has made me more adaptable to being the only man of color in a room.
Mm.
Yeah.
Nah, that's deep, man. That is interesting. I think
Mic drop right there.
nah, that is a mic drop moment. That's like I feel like I have noticed that in my public health experiences thus far. I feel like it's it's very difficult to just be in the field, period, because you're serving all sorts of different populations of people. Like you have to have some sort of empathy, and it's basically just a prerequisite to have some sort of just general respect for everyone and all backgrounds, ethnicities, walks of life. So I understand that point. I feel like that's very much a part of just the public health culture in general nowadays. But I do understand what you're saying too, to the extent that like even with that being said, it's still just hits different when another brother's in there in the room with you, so you're not the only one there. So you know, because that's another part of like just representation, just for representation, just having someone else that can relate to you in another type of way. I feel you. That's what's up.
Especially when it comes to like to give care or like help. It's important to be able to find somebody who can resonate with, maybe if it's not an identical walk of life, there are definitely commonalities in our walks of life that I think are unique to men of color.
Yeah, yeah. I think yes, especially in a program or in a public health setting like a community health center or something like that, where I don't know, like maybe you are working with clientele or like a population that is serving men of color. I think, or even like I don't know, like someone like me. I think the fact that you were a man of color coming into Randolph High School on behalf of Codman, that resonated with me too. Just having some representation out there in the field is nice to have too. Even if like the general culture of public health is empathetic towards everyone. It's always nice to have another brother out there represent. So that's what's up. All right, but with that being another another part of your identity at the moment, because we're all gonna get older eventually, but not yet for you though. You're still a young bug out here. A young, like the word says, the YN award. You're in between that YN award and the Big Bro award, so you're still in that middle range. I'm not trying to. You're not unstatus yet, Dalwin. So I still consider you a young professional.
Appreciate that.
I still yeah you graduated pretty recently, like 2020s. I'll give you the pass for now. You're my personal big brother though. So but I'm going on a tangent. As a young professional, Darwin, and as someone who's just worked heavily with youth leaders and youth health advisory councils, you are like the voice of, in my opinion, you're like one of the voices of youth in the public health sector. Like you bring new young energy, new young ideas, and you do work with a lot of young people who are in public health. So, as someone who is a young professional, tell us about like your experience and like what's something that you think that young people are bringing to the health equity conversation nowadays, and maybe is it something that you think the older generations might be missing?
And, as a professional,
Mm.
as a young professional, I just want to call out that ageism still exists. So I think a lot of people, like, I just want to first start by saying, like, I think a lot of people think about ageism towards older generations, whether it be a boomer or whatever. But ageism exists in the professional setting context towards younger generations like Gen Z. I don't want to say alpha generation because they're not in the workplace yet. I'm scared of them. I will say that. My brother's an alpha. I'm scared of him. He's 7. I'm scared. But I think how we perceive older, younger generation, ageism goes both ways. I think the value add that a younger, like a Gen Zer like myself, like you and other folks, Savion, bring to the field and to the profession is, to your point, the energy. Secondly, I would say we have technology. Like we are very versed in how to leverage technology to increase and enhance how we raise awareness around public health issues, how we engage community in advocating for community-based needs, how we communicate just opportunities like scholarships, fellowships, jobs, whatever the opportunity be. I think that is an asset to our generation is that we have the ability to flex, for lack of a better word, technology in our advantage. I think I see a lot more younger folks in the public health field who are, I mean, and I wouldn't even limit it to Gen Z. Like, you got to look at the millennials, especially like bros like Omari and Winston and Miles and Aaron, like they're doing the work, bro. Foundation, hospital systems, philanthropic organizations, state government. Like, come on. And what is a theme across this millennial generation is that they can flex tech just as much as Gen Z. And I think that is where there is so much synergy across generations that I know your question was like, what can younger generations be bringing? But I think this is like a bridging opportunity because I bought one of my bosses is a boomer. She's a baby boomer, and I'm a Gen Z. Like we're like totally far off. Yeah, complete opposites. However, when she and I come together, I learn so much from her,
Mm.
and she learns so much from me. And I think that that is where the opportunity exists for us to rebuild and make public health infrastructure stronger and truly address the root causes of disparities and marginalization comes with us forgetting about what generation we're from. Like, I don't care how old you are. I truly don't. And you shouldn't care how old I am. I'm in this position because I'm a qualified professional, just like you are. And let's come together and learn from each other, share how we can come together and make something stronger and that truly addresses the issue.
Wow. That's the ideal situation, man. The collaboration, man.
I'm a hope. What is it? Hopeless optimistic. Like I just dream, bro. I truly just dream, and I think Martin Luther King. I have a dream, brother. I don't want to get assassinated. And I do think that as a society, we need to empathize, be more compassionate, be more flexible, and truly forget about the differences and just come together as community. Because at the end of the day, if we want to see change, we have to come together and we have to work together.
Preach, Darwin, preach. Hey, that's another mic drop moment. We had two for mic drop moments right now. Let's keep it going though. Let's keep it going. This is one of my favorite parts of the segment or favorite parts of the podcast. It's the public health breakdown. So, Darwin, as a public health professional and just as a student, as a scholar of all things public health, all things health equity, all things social justice, could you explain one important public health concept that everyone needs to know about?
Great question. And I would consider myself a scholar practitioner
Mm.
because I'm a I'm a quote Michael Curry. I'm a student of history. Or yeah, something along those lines. I shouldn't have said I'm a quote Michael Curry. But you know that's something that he preaches. You know, it's like he always loves to learn. He always likes to understand history and how history repeats itself. And that's why I see myself as like a never-ending learner. Like I'm always gonna want to learn. I'm always gonna want to understand or just know or be up to date. And I think a public health term that often gets overlooked in public health is healthy masculinity, actually. I think for folks who don't know what healthy masculinity is, it's a positive reframing of what we typically refer to as toxic masculinity. But really, healthy masculinity is really being for men. And I think, in particular, I think this is very important for men of color to really be able to reframe, reshift their minds, perspectives, and understandings of how they can fully express a range of emotions, practice accountability, use your personal strengths to support other brothers and other men. It doesn't even need to be a man of color. Healthy masculinity applies to any male identifying, male presenting person. You don't have to be a born male to perform or practice. I should say practice, because perform, you don't want to do a performance. You just want to have an ongoing practice of healthy masculinity. And I think how that term intersects with public health is critical to understand, because men of color have higher rates of hypertension, diabetes, substance use, alcoholism, depression, anxiety, suicidality. I mean, the list goes on and on and on. Men of color are we're facing an epidemic. Like we're dying, we're committing suicide at higher rates than any other group. And this is referring to just men, not even delving into the specifics of men of color, just men. We commit suicide at higher rates than other people. And also, I shouldn't use the use the term commit suicide. Um, I would prefer to say and redact that as like attempting suicide. Because you commit murder, you don't commit suicide, is how I think of it. But to finish that thought, really, I think healthy masculinity needs to be a practice, needs to be spoken more about among men, and in particular too, like calling out men of color. Hold yourself accountable. Ask for help. Seek help. Go get that checkup. Go get that preventative care. Go get that colorectal cancer. Go get that prostate cancer checkup. Like, go check your ALC1 for diabetes. Like, go do the things that prevent you from dying sooner, getting sicker, and not living a long life. I actually attended shout out again to Curry. Like you talk about me as my mentor and your inspiration. I talk about Michael Curry as my mentor and my inspiration. Like this man really gave me the opportunity to like really step into a space that I haven't been in before, supporting the Boston Public Health Commission with their Black Men's Health Activation Summit, and really working to literally reduce or increase, I should say, increase life expectancy for Black men here in Boston. And so back in June, we actually attended a summit. And one of the things that has stayed with me, this was like early June. I've been all over since then, but it's literally ingrained in my brain. And it's that in Boston, Black men live 9 years fewer than any other racial ethnic male group. And that's absurd. And so actually Dr. Kevin Simon, he's the a chief he's like the chief behavioral health officer for the Boston Public Health Commission. Amazing, like a smart man, smart brother in public health. And he spoke, like the analogy he used was like 9 years, that's like nine birthdays, 9 years of good morning, 9 years of first days of school, 9 years of anniversaries, 9 years of whatever it is that we, you and I, Black men, brothers in Boston, are losing out on. And that's unacceptable. And that's only looking at Boston. So imagine the stark disparity for life expectancy for men of color, Black men, whatever group you want to look at, across the country, across the world. I bet you 9 years, it's probably going to be more than 9 years at that point. And that's sad. And that is why I think we need to practice, talk more, normalize men feeling, men asking for help, men feeling emotions, men expressing emotions, men crying. Like, I don't know about you, but when I cry, I feel better. It alleviates me.
Man, that statistic is crazy, dog. I did not know that. It sounds legit though. I'm not gonna lie. Like just national statistics. I'm not surprised to hear that. And that it's the the way that, especially for Boston, man. Do you think that all these hospitals out here claiming we're this super progressive city that there would be such? Do you think the gap would be a lot closer? And like, maybe it is compared to the rest of the nation, man. But that just goes to show like how deeply ingrained these social inequities are in our nation, man, and just how deeply ingrained these toxic survival tactics have been ingrained in just the psyche of our communities, man. Like, I can't even like, I don't know, man. That's definitely a great topic you picked there, dog. That might be my drop number three, man. Because we need to take care of ourselves, man. I hope you're taking care of yourself. I hope you make it. I hope you earn 9 more years, 9 years above the average, at least,
Yes, I love that. I love that.
man. But
So,
some,
we can't shit on Boston, because
yeah,
Massachusetts is so progressive. Like, we have so many safety nets. Like, like Boston is doing, like, Massachusetts as a whole is doing great. So is Boston. Like, I'd be interested to know, like, what that rate is in, like, Miami or Atlanta or Memphis. I don't know, or like Mississippi. Like, what is the life expectancy of black men in your city? And I think that's a calling to just larger scale investments and awareness for other states, other cities, other countries to like look at how long are your men of color actually living? And then if not your men of color, like your black man, your biracial man, like I think it's worth looking at those life expectancy and like what are the chronic conditions, diseases, illnesses, ailments truly affecting that population. Because I don't think we're doing enough of it. And I think something that hinders us from doing it is the shame, uh, the
there's just so many factors, man. Like to an
yeah,
extent, I can't even like. There's definitely like the part of it that's just like socially, like just things that have been passed down from generational trauma, like oh, working ourselves to death, trying to
big
like not like you said, not taking days off, not being emotional, just certain things that have been passed down. But I don't know. A lot of these are just like survival tactics, just to make it in America. The system's stacked up against us, man. But you have to fight. You have to fight for your health, man. You have to fight for your vulnerability, your ability to express yourself. Fight for a change, man. Fight for your health, man. And we're gonna do ourselves. We're gonna fight for on the policy side. The brothers in public health are gonna fight on the policy side, but we need y'all to just keep fighting for your families, fighting for your lives, because the system don't want to see us outlive those 9 years out, man. They don't want to see it happen. So just keep fighting, man.
And it's a stigma, and I feel like back to your earlier question about like, what does the younger generation bring that you know, it's the energy, it's I think as a Gen Zer, I feel like we have a lot more, and I'll even include at least the millennials that I've gotten to work, like, like the ones on our board, they're a lot more understanding than some people in older generations. And I think that it's really all about removing the barriers, reducing the kind of stigma around talking, feeling, and to your point, advocating. Like, I don't really think people understand the power that we have to when we vote. Like, I understand when you're talking like federal, national, like voting, yeah, sure, that might look different. But when it comes to like your city councilors, like local voting makes a difference. And I think that that's where we need to be. We need to be at the polls. You got to be at the polls and voting for the people who are representing your local districts and municipalities. Because I think that's how we start changing things.
Just keep advocating for ourselves, man. Keep pushing, keep breaking the generational trauma years, man. It's time to reinvent that, man. I really appreciate you bringing up this topic. This is what Brothers in Public Health is all about. Very important topic, manner, but Let's let's sprint to the finish line with some rapid fire fun kind of questions. So, but I'm gonna ask a question real quick, and then you'll say your answer, and then I don't know, but it'll be like fast paced. You know. So you think you're ready for this law one?
Let's do this.
All right. So Darwin, Mr. Program Coordinator,
Manager.
if you had an unlimited budget to host a nationwide Brothers in Public Health conference, because I know that's something you do. You like to you're very good at hosting conferences and organizing meetings and all that. So if you were responsible for hosting one for Brothers in Public Health and you had an unlimited budget, what would you plan? Like, where'd the location be? Who would you pick for a keynote speaker? What would you do as like a little breakout room type activity? Go.
I'm trying to work on it with Brothers in Public Health as Director of Strategic Partnerships and Development, trying to get that unlimited budget. We'll have a weekend. Boston was our first chapter. That was our inaugural chapter. That was Savian and I co-founded our first chapter that's blown up across the country now with Brothers in Public Health. So location, we in Boston. 3 day weekend, Friday through Sunday. I met this brother, his name is Colin Knight with Live Like a Local Tours. Brother does local based black story like led history in Boston. So we'd go to like Roxbury or Dorchester, Nubian Square and do a tour of that. Go to like a local mom and pop shop for dinner, lunch, whatever it is. Then that's the Friday half day. Saturday, we'd volunteer. We'd go to the community, like do some trash pickup type stuff. Then we'd like have a keynote. I mean, I've said how many times have I said Michael Curry? Damn, he got to promote us at this point. But Michael Curry, like that man, he was the president. He was the chapter president for the NAACP here in Boston. He is a true civil rights, social justice leader who has dedicated his life and his work to uplifting us brothers in public health. So right there you go. Boston based too. You grew up in, I don't want to say, but anyways, so keynote activity, we'd end the weekend by going to Hue, which is a black owned bar lounge here in Boston, Back Bay area. So we'd turn up with some more brothers and sisters, honestly. We'd like, and there will be some learning and workshops and updates throughout the day. To your point about unlimited money, that weekend we would like announce some crazy scholarship award. Like, let's say I know we do $1,000, but let's unlimited to your question. 10 grand scholarship, 50 grand, like it's unlimited.
Yo,
Full tuition.
yeah.
There you go. There you go.
That's lit, bro. I'm surprised you picked. I mean, I'm not surprised, but like Boston as the location. I mean, you're new to the city though. Like, I mean,
I'm
you
repping my new city.
you're
I'm
repping
repping my
Boston.
new city.
I gotta respect it, but once you've been here once, I think you've seen it all. But I think it'll be cool for the brothers who haven't been here to see it once, and then I think they'll be good. But that's just me hating though. That's a nice plan, dog. I'm looking forward to that once it comes into fruition, man. If y'all in the network or want to be in the network, y'all gotta get tapped in if you're trying to go to this conference, man. This we're gonna turn into reality. It's cooking right now though. Y'all stay tuned. All right, question number two, darling. Question number two: which public health myth grinds your gears the most, and why? Go.
Climate change is not real. That is a big myth. Climate change is real, bro, and that shit grinds my gears. So I can say that I've lived in the New England region, going to undergrad, then moving to Rhode Island, then now living in Boston. That's been like about 7, 8 year spectrum span. It does not snow anymore here. Climate change is real. Like this past winter, yeah, that was rough. But prior to that, like it doesn't snow that much. Like, come on, stop. We see the ice glaciers in Antarctica or wherever melting, crumbling, polar bears. Like I just want to cry.
For real.
Believe the science. The science is not a lie. Climate change is real.
Yeah, I turned my AC off for the podcast so it wasn't blowing in the background, but you might probably see it a little bit, some sweat coming off my forehead, man. It's
You
hot.
can't tell, bro. You can't tell. You look good. You look good, bro.
It looks like lotion right now. You know, I don't know. There you go.
You're moisturized, sun
Yeah,
kissed.
yes, some kids, bro. Facts. All right, question number three. If you could pick a superpower to aid you in your public health career, which would you pick and why? Mm.
The power to grow money from trees. You could see a money tree, but that's
Ooh.
like in my background. But that's not like a real money. Like my hand, I just go outside, touch some soil, wet the soil, and immediately it'll be like $100 bills
Wow.
as leaves, and it never dies. The trees never die, regardless of the fact that climate change is real. These trees do not die, do not catch on fire. They will last forever.
Wow.
So can I tell you, if I had that power, that's how we'll make that conference a dream. And
Mm.
anything else.
What's one other thing that you would do besides the conference and the scholarship? And
And
that's
this
the two big
conference,
things.
the scholarship, pay the interns. We are all volunteer based organization, like from the executive national team to our interns to our chapter leads across the country doing on the ground work. Like I think a big part of the issue with with economic mobility is that we don't compensate folks. We all do things because we care. We want to help. We want to give back. So being able to compensate people for their time is something that I truly believe in. So if we had unlimited money, if we didn't have to pay taxes, I know taxes are important, but once you get paid and you got to start paying taxes, that you just don't have money again.
Yeah.
But anyways, I'd be able to compensate each and every one of us, give stipends to anybody who wants to join a podcast, who wants to join a one of our national speaker series events, wants to join a local chapter event. Like we need to be empowering and promoting that economic mobility and financial growth and upward mobility that we all preach.
Hmm. Yeah, I think that's interesting. I feel like when I talk to people about public health, a lot of people are like, "Oh, that's cool stuff. Like, it's a cool career pathway, but can I actually make money doing that? Like, can I actually like pay a mortgage and support a family off public health work?" And I'm like, some jobs in public health, yeah, but there's, I don't know, it fluctuates within the years, man. So I think a money tree that'd be nice to have a consistent backbone to the public health work that we got going on. That's a good pick right there, dog. But my last and final question to wrap up, put a bow on this episode, is what is one piece of advice that you give a young brother out there listening right now, considering pursuing public health?
Don't be afraid. Just do it. The Nike slogan. Nike got to sponsor us now. But just do it, bro. Don't be afraid. Don't be afraid to explore something new. I think like my experience was when upbringing, doctor, lawyer. It doesn't need to be that. It doesn't need to be black and white. Don't be afraid to step out the box. The breadth and depth of careers in public health is so broad, so deep, so mission driven that you can find meaningful work that gives back, but also helps you. as an individual, grow and learn. So don't be afraid to try something different. Don't be afraid to join a new club, get a new job, get a new internship, apply for whatever it is that even inspires or ignites a little curiosity of like, what if I got this? Just follow your heart, follow your gut, because at the end of the day, I truly believe that everything happens for a reason and everything is gonna work out at the end of the day.
Mic drop number 4, number 5, number 6, whatever it is, man. But bars, man. I feel like everyone who I've talked to so far, public health, that's something that they stumbled upon and fell in love with just as a matter of them, as a result of them just trying something out, man. So if there's any public health opportunities out there, young brothers in the audience, high school, college, whatever you are, even if you want to do change your careers or anything, if there's an opportunity for you to get involved in public health, it doesn't have to be like the full career path. Like if you want to invest in your community, just try to get involved, man. Try to do it. Take that risk. Try public health, man. Like give public health a chance. Give you put, and I promise, public health will treat you right. There you go. But thank you so much, Darwin. That was an awesome episode. So happy that you were a guest today. That was so many bars today. Oh my goodness.
Appreciate it. Thank you for having me. This is a pleasure of mine. Like I'm so grateful for this opportunity. And for you, like you're doing an amazing job, bro. And I'm so excited to see how like that MDMPH after Scott, like Dr. Scott with an MPH too.
We'll see. Hey, hey, we'll see, man. But
I believe
we
in you,
gotta
brother.
try it. We'll try. We'll try,
I
man.
believe in you.
Anything you want to shout out before we wrap up the episode? Anyone out there you want to shout out, or any social media that you want to plug at all?
To give a shout out to my mom and my little brother Dylan. Like that kid is my heart. He is what keeps me going every day. He is who reminds me of why I want to be a public health scholar practitioner because he deserves a better future, a better life, a better society, a more just, equitable, and compassionate society and system, I should say as well. And I love him with my heart. He's only 7 years old. We have a 17-year age difference, but he's my energy and what my light, my light. He's my light.
Shout out Dylan, man. Shout out Dylan. Clap it up for Dylan, man. Yes, sir. And lastly, as we wrap up this episode, I just want to say thank you again, Darwin, and thank you to Brothers in Public Health for giving me the platform to have this project. And thank you to everyone out there in the audience listening. I know we're still growing and everything, but thank you to those who made it to the end. If you want,
Shout out to all the brothers in public health.
yeah, shout out to Brothers in Public Health, man. If you're interested in joining Brothers in Public Health or just staying tuned to what we're doing, follow us on LinkedIn, Instagram at Brothers in Public Health. If you're interested in donating or potentially becoming a member, check out our website at brosinpublichealth.org and just stay tuned for more podcast episodes. We're gonna keep this going, man. We're gonna keep it going. But with that being said, that's a wrap to the episode. So peace out, y'all.